Good morning, and welcome to today's interview that we're having in recognition of Sun Safety Month in August. I'm joined today by our editorial board member, Dr. Matt Hadfield, who is here today to share some important information to raise awareness of and keep in mind during Sun Safety Month. Matt, great to have you on as always.
Kira, thank you for having me. I'm a cutaneous oncologist, so Sun Safety Month is a topic that's very near and dear to me and important, and happy to have the chance to talk about it.
Absolutely. So to start off, for some background, I'd like to tell us what exactly is UV light and how does it cause cancer?
Yeah, so UV rays are light that is emitted from the sun, and UVA rays are different than UVB rays, and that UVA rays are less intense than UVB rays. Um, and UVA rays are more present in sunlight. So essentially, what happens is the UVB rays are they can penetrate deeper into your skin and induce damage to your DNA. So just like any environmental toxin can impact your cells and cause DNA damage. UV light does that. So while it's very fun and great to be on the beach in the summertime, especially here in Rhode Island, UV light is damages your DNA, and what happens is your DNA has these mechanisms that are built into it to try and repair itself. So what occurs is that your DNA will break from UV light, and the mechanisms in your cell will put the DNA back together. And when it does, it can cause mutations because that process for repairing DNA is not perfect, and those mutations can ultimately lead to skin cancers like melanoma or squamous cell carcinoma or basal cell carcinoma, and that's why sun safety is so important.
Absolutely. And then how does sunblock work?
So sunblock is essentially an opaque barrier to try and prevent the UV light from penetrating into your skin and impacting your DNA. There's multiple different types. Zinc-based sunblock, which is kind of the older sunblock. It's what you would imagine when like kids had their nose completely white. It's very caked on, more of a physical barrier, and then newer both lotions and spray sunblocks use different chemicals to increase the opacity of the barrier essentially. And one of the things that has come up that is quite an important topic right now is whether or not there's any harm by using newer sunblocks. There's been recent data that would suggest that, or there's been recent concern that newer sunblocks that contain more of a chemical um, way of blocking UV light can cause cancer. I think the ultimate answer to that question is right now, what we know is that there has been research that has shown that these chemicals can enter into your bloodstream. That inherently doesn't mean that they cause cancer or are related to an increased risk of cancer. So the real answer is we don't know. Um, I would say to anyone concerned about that specific topic, sunblock is we know the benefits of sunblock. We know that sunburns and sun exposure and UV exposure are linked to different skin cancers. So the benefits certainly outweigh the risks. If you're very concerned about that, there's zinc-based products like I had mentioned, or just physical barriers like wearing uh, uh, you know a long shirt or a hat, trying to keep the sun off you, trying to be in the shade, different methods if you want to avoid the chemical-based sunblocks.
Definitely. And then, do you have any other suggestions or tips for physicians about counseling their patients about sun safety and other measures that they can take?
I think so. We know that sunburns are linked to risk for cancer. So as I mentioned, melanomas, squamous cell carcinomas, and basal cell carcinomas. And we know that, oftentimes it's a sunburn that happened, a long time ago that may predispose you to cancer now. There are different medications that dermatologists can prescribe if you're at an increased risk or concerned about that. And I think that's honestly a type of conversation I think is important to have with your dermatologist. So if you were concerned about if you've had heavy exposure to sun in the past or lots of sunburns, lots of times it can be that you spent an enormous amount of time outside as a kid and you got burned all the time, and now you're concerned now as an adult and you want to know what to do. I think the far and away the best thing is to always just pay attention to your skin. You want to make sure that you notice if there's any new spots on your skin, new moles, and we always keep in mind the ABCDE of melanoma. So A would be asymmetry. If you have a mole that's it's not symmetrical in some way, the border, if it's blurred, notched, or it's irregular, color. So generally speaking, if a mole is multiple different colors in it, so multiple different shades of brown, for instance, that would be concerning. The diameter, anything that's larger than about pencil eraser size, so like 6 millimeters, you would want to certainly get checked out by a dermatologist. And then evolving. So is it changing? Is the color changing? Is the texture changing? This is the type of thing where you know yourself better than anyone else. So while a physician can certainly look at something or biopsy something, the number one thing we know with cancer and skin cancer is no exception, is that catching it early is the best way to treat it prior to it turning into something that has become more invasive or has spread to other parts of your body. So, I would also say that even if you've had a lot of sun exposure in the past, it doesn't mean that you can't have good sun safety practices now. We know that increased sun exposure, even after you've been diagnosed with a cancer, can help prevent the development of future cancers. So it's not impossible to have a melanoma that was taken off by a surgeon or dermatologist and then developing another one. So all important things to keep in mind when thinking about sun safety and if you've had past exposure.
Definitely. It's all really great advice. And as far as different situations, how should physicians approach counseling patients who might have photosensitive conditions or those who are on medications that increase sun sensitivity?
Yeah, so of course, certain antibiotics can predispose you to being more at risk of burning, as well as you know having a photosensitivity at baseline. Different patients with different complexions can be more at risk for burning. I would say with sun safety in general, far and away, I think being more cautious is always better than being less cautious. I think it's a very hard thing because often sun safety we immediately think of being outside on the beach or at a lake or at a pool or working outside. Often in those fun situations, you forget about sunblock or you forget about wearing a hat or getting some time in the shade. And if you're on a medication or you have a skin type that makes you even more prone to burning, you're at an even higher risk of having a significant burn that could predispose you to a cancer. So as much as sun safety, as much as of a Debbie Downer as it is, you have to kind of be vigilant and make sure you're protecting your skin because there is a well delineated correlation with getting burns and developing skin cancers.
Absolutely. And then, are there any emerging therapies or interventions in the prevention or management of UV-induced skin damage that clinicians should be aware of?
So yeah, I think there are certainly medications that I mentioned both for local and more of a systemic way to treat damaged skin. And that's something that a dermatologist would be able to counsel patients about. Um, I think that in my mind, emerging therapies and things of that nature are certainly good, and I'm glad that we're always developing therapies, not only for that indication, but also for the treatment of cancer. We're developing new therapies all the time. I still think that the best thing is to just try and avoid sun exposure. It is, and if you're concerned, see your primary care physician and make sure that you go see a dermatologist to get a full body exam. I think those are really, um, we know that if you're vigilant with looking for any signs of something concerning or new, that if you go and catch something earlier, there's a higher chance that it can be taken off by, again, a dermatologist or a surgeon, and from there, hopefully it's not an issue for you in the future. So, um, being vigilant with sunblock, sun barriers, and also just keeping an eye out to see if you have any new moles or anything changing is honestly is better than any emerging therapy in my mind.
Absolutely. And then as we wrap up today, any parting messages you have to raise awareness for both the public as well as clinicians in honor of Sun Safety Month?
Yeah, like I said, Sun Safety Month is it's near and dear to me and the ocean state of Rhode Island. So we have a lot of coastline, a lot of beaches, and I have young children, and being out in the sun is obviously that's the best part of summer. But it can be very sneaky when you're out in the sun, you're having fun, to not stay on top of things like sunblock. And again, if you're concerned about you know sunblock causing cancer or having any negative health impacts, then by all means look into alternatives like zinc-based products, or just wearing like long sleeve shirts and things that protect most of your body, because we know that the amount of skin that's exposed exposes your risk of developing um, a burn. So I think we know that reducing sun exposure and UV exposure will reduce the risk of burns, which will reduce the risk of cancer. It's just finding whatever you're most comfortable with, but making sure that that's what you're doing, because you want to try as much as you can to not have you or anyone in your family develop burns while you're having fun.
Absolutely. Well, these are all really great things to have in mind as we're enjoying the summer, this Sun Safety Month. So thanks again for coming on to share them with us.
Thank you so much for having me.